So my unit in the medical ICU, we're a 26-bed unit. And we right now are the critical care coronavirus COVID-19 unit. So any rule outs, so people that are getting worked up and investigated for coronavirus, or those that are positive that require critical care treatments, come to me. So we are between the emergency department, one of our inpatient units, and us, we are the front lines of this disease. So yeah, we have a lot of exposure. In my 13-hour shift, I am exposed. We are doing a lot of really fantastic things by trying to bring everything outside of the room. So our IV pumps, we're adjusting the beds, the ventilators, the monitors actually can be outside of the room. Anything that we can do, we're limiting. We're clustering our cares, we're clustering our medications. The pharmacists have been fantastic of helping us limit my 13 hours in a room. So by that, we're limiting our exposure, but we're in it. So I definitely am concerned. But again, like I said, if I believe in my personal protective equipment, and if I believe that I'm putting it on and taking it off appropriately, and I'm hand washing, that I'm supposed to be protected, and I have to believe in that. So, and that's the way we are on our unit. We have to believe that we're safe and we're doing it right. Personally, I'm very fearful. This has been really scary. Watching this come from the coasts in, we're here. I mean, we're in this and it's not going anywhere. So taking the safer at home mentality and quarantining and isolating is super important. We've got to flatten this curve. And by flattening the curve, what I mean is we've got to lessen the exposure so that me and my staff can properly care for the patients that are affected with this COVID-19 coronavirus, because without flattening this curve, we won't have the resources to take care of them. Yeah, so from the Froedtert perspective, we're actually looking really good right now. We are allotting each person to have one pair of goggles that we sanitize and clean between uses. And then we each are given one respirator, the N95 masks that everyone knows about now. So we're given one, and we use that one until it's no good anymore, whether it breaks or we've utilized its usage before it gets too stretched out and we're not getting the proper seal that it requires. But right now we're looking good. We fortunately right now, and we have been graciously donated a lot of masks, and we've been collecting them, and communities are donating. We've had other units donate their masks. So the rate we're at, I will always have a mask. So while I can rotate that through. So today I can say yes, I'm protected. I hope I can stay that way. I hope other hospitals in the country can stay that way. I know other countries were not as fortunate to be able to have those resources. So I've got to stay optimistic. Otherwise I can't do my job.
For people who don't know, you have a new baby.
Yeah, it's Michael and myself and little baby Nora at our house. So my first message to myself and those that are in the front line like me and in the healthcare profession, or even if you're an employee at a grocery store or at Costco or things that are still considered essential and you're open to business, is taking the precautions, hand washing, keeping the social distancing. I have to believe in my personal protective equipment, my gloves and my goggles and my face masks. Otherwise, I'm going to drive myself crazy. I wouldn't be able to consciously go home and feel safe that I'm around my family without it. So believing in that makes me believe that I'm safe. I also don't touch her when I get home. I immediately run up, I take off all my clothes, I shower, and I won't even come in contact with my family until I've done all of that. Michael's been amazing and helping take care of her, and he knows nothing. I don't come in contact with either of them until I come home and I've done all my precautions. And I would say that for anybody that's home. So if you're exposed or you're out and about, immediately hand wash. If you feel like it's appropriate to shower or change, but it can live on the surfaces, they're saying, for like up to 21 days, we're hearing at this point. So it keeps getting longer and keeps getting more fearful. But hot water, soap, bleach, everything that we have around the home is appropriate to clean. So just being very aware of what you're touching, those high point touch points at your home. So symptoms that we're being told per the CDC is shortness of breath, a cough, like respiratory symptoms, but with a fever. And the fever is kind of that flag of when we need to really be concerned. Also keep in mind though that we're being told that people are asymptomatic, and the shedding of the virus. So that time of exposure to when you are contagious can be anywhere from 2 days to 14 days. So that's why we're kind of being told this 14-day quarantine, but you can be contagious before you even have your own symptoms. But the fever is the key, but having those respiratory symptoms, and the people that I know that have had it, or my patients that we're seeing, that shortness of breath and cough, and it's a non-productive cough really that we're seeing. In regards to when you should get seen, definitely call before you go anywhere. Self-quarantining and isolating is your number one priority, and picking up the phone and calling your primary provider. If you don't have a primary provider, calling an urgent care or any clinic, and they will triage you. Everything is triaged over the phone. And by triage, I mean they're going to ask you a surveillance of questions. It's going to be your symptoms. It's going to be who you've been in contact with. It's going to be where were you traveling, anything that lists of exposure. And then once you've answered that questionnaire survey over the phone, then they would determine what your next point of intervention should be. Is it going to be self-isolating and waiting it out? Or is it going to be waiting for worsening symptoms? Or are they going to actually test you? But testing honestly isn't always the first priority. It's quarantining and self-isolating. You know, it's difficult, but I really have to compliment my team. We have been able to kind of come together, and we're in this, whether we like it or not. We don't really have a choice, but we're good. We've gotten the time to prepare. So I just have to believe that today was a good day. Today was a safe day, and I have to keep living. Yeah.